Greetings from Human Biological Institute. Welcome to yet another engaging session of our scientific forum, We Talk Do You. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one of its kind platform, Puberty to Menopause. These sessions feature leading experts from across the country who share their valuable insights on the key health topics aimed to raise awareness and promote overall well-being of the society at large. Today, we are delighted to have Dr. Satish Sharma with us to share his expert perspective on hepatitis A in children and adults. I shall be sharing more about today's speaker in a short while. For the moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited, a One Health company, with the vision of shaping global healthcare by spearheading One Health initiative. IL was established by National Dairy Development Board in the year 1982 as its unit and later registered as a company in 1999 with the name of Indian Immunologicals Limited. Human Biological Institute (HBI) was established in the year 1998 when the Government of India requested IL to produce a modern tissue culture rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind to have rolled out first Verocell purified rabies vaccine in 2000. Subsequently, HBI launched other vaccines and currently we are the major player in human vaccine segment. HBI is a leader in ARV segment and present in around 60 countries. HBI has got three state-of-the-art manufacturing facility, which is at Ooty, Gachibowli, Karkapatla, that is Genome Valley. Human Biological Institute has also forayed into market of clinically proven wellness products and infertility range of products. With a vision of shaping global healthcare by spearheading One Health initiative, with a mission to innovate, produce, and market quality healthcare products and services to improve and extend lives, HBI values we believe in providing affordable products with high quality through continuous technological innovations and improvements to meet our customers' needs. As a part of corporate social responsibility, IL has adopted government schools. IL has adopted two government schools in the vicinity of Karkapatla facility at Hyderabad. IL is providing infrastructure and basic facilities, including help in the midday meal scheme program. With the help of NDDB, IL is giving milk, everyday milk, to over 2,500 school-going children in the Telangana and Tamil Nadu. IL also donated oxygen generation plant to TIMS Gachibowli, which is in Telangana. These are the key highlights of IIL and Indian Human Biological Institute. To know more, please follow us on the social media channel and www.indimmune.com. Uh, Puberty to menopause is one of its unique initiative where we address a wide range of topics related to human health and well-being. Welcome to today's episode on We Talk Do You. This session is dedicated to highly significant and often overlooked topic that is hepatitis A in children and adults. To help us better understand this hepatitis A and its impact, we are joined today by Dr. Satish Sharma. So please join me in welcoming Dr. Satish Sharma. Welcome, welcome, Dr. Satish, to the show.
Okay. Thank you, sir.
Uh, yeah. So I would like to share something about Dr. Satish Sharma. Yeah. Dr. Satish Sharma is MD in pediatrics. He is a medical advisor and senior consultant pediatrician at Argus Super Specialty Medical Center, New Delhi. He has experience of over 30 years. His affiliations are National Senior Vice President IAP Norzone 2024, Chairman Indian College of Pediatrics Accreditation Committee, Secretary General IAP Medico Legal Chapter 2022-25, Founder Secretary IAP National Respiratory Chapter Haryana 2021-24. His achievements are EB member National Infectious Disease Chapter 2021-23. He was past president of IAP Haryana. He has got Lifetime Achievement Award by IAP Haryana in 2016. He is a speaker in various forums like Pedicon and published several papers in many reputed journals. Today, we are delighted to have Dr. Satish Sharma to the show. Welcome once again, Doctor.
Thank you, sir.
Yeah.
Good evening, everyone. And the Human Biological Initiative, I convey my sincere thanks at the very outset because they have kept this topic, hepatitis A, in monsoon and this post-monsoon. Lot of cases of jaundice they are coming these days, and it is worth educating the masses that how this develop, what are its causes, and will affect or not, because many people they are not aware about this. And hepatitis A is common. That's why we are discussing today hepatitis A. Otherwise, the infection of the liver is caused by hepatitis A. It can be caused by B. It can be caused by C, D, E. So out of these, hepatitis B is through the blood, hepatitis C through the blood, and these are very, not considered good, and they are very dangerous. And hepatitis A and hepatitis E, these are caused by the drinking, consuming your infected food and the water, so the water
So,
sanitation.
so, Doctor,
Yeah,
could you please let us know what is this hepatitis A as such, whether it is been transmitted by a bacteria or a virus, and how it is transmitted and how it risks to the public?
this hepatitis A is a DNA virus, and this virus it spread primarily through the contaminated food and the water, and this affect both children and the adult, all ages it affect, all state of the society, whether their socioeconomic status is high, middle, or the others, and it is transmitted fecal-oral route. It means that people who consume food or water touches the surface or contaminated with the stool or feces or excreta of the infected patient. And it is common in the area with poor sanitation and the hygiene. It means there is no proper, this excreta disposal. So water is not good quality water. Okay, so children, it is common in both. All ages I have told about the ages. Yeah.
So, as you said, doctor, so it is very clear that yes, hepatitis A is a virus. Is a viral infection, and it spreads through contaminated food and water. So, does that mean that a person who is infected with hepatitis A, if it touches or maybe comes in contact or share the food or share the drinking maybe the water bottle or maybe the glass, the other person may get contracted.
Yeah, this is possible because the viruses they are shed in the stool or excreta of the patient suffering from viral hepatitis. And if somehow, if the excreta or waste is not properly done, no sanitation facilities are there. So these viruses they come to the surfaces, whether they are utensils or the other say, and if they touch this utensil and then they take something into the mouth, so these
Yeah.
viruses go into the our mouth and the our GIT tract, and that's why they cause the disease. So,
Fine.
so by
So can
contamination, so two way. One is
yeah.
by consuming the contaminated water and the food,
Hmm.
particularly when there is lot of humidity and warm is there, and the children they are going outside, maybe in the school also they are gathering in the daycare center also there, and they are consuming, some person they are consuming food outside which are not covered well, or cut fruits in the market.
Yeah.
Okay, so they are the source of this virus, and they can lead to the infection and to this mm, everyone.
So, doctor, in your practice, because of your practice, you see so many cases. Like, what kind of symptoms people come up with hepatitis A, and when people should reach out to doctor?
Yeah, the children they vary in child, who will say less than a smaller child, 2 or 3 year or 4 year, or if we see the adolescent child 10 to 15 year, or we see the adult, because it is estimate that 85% of the children below 2 years and 50% children below between 2 to 5 year, they don't have clear cut jaundice. This is called anectic hepatitis. It means they don't manifest. So they are, non-specific symptom, which any viral infection, malaise, tiredness, fever, nausea, vomiting, pain, stomach ache, then not eating well, not taking interest. So like that, some diarrhea also there. So they are the symptom. They are called the non-specific. Any viral infection have these symptom. So the most of the children they get it, but some after few days the fever settles, and sometime there is something start coming in the eyes, or they will ask that urine is dark color. So
Okay.
when it come into the eye, urine darker, it means it has advanced, you know. And but in adolescent, they have jaundice appearance earlier as compared to younger children also. Yeah,
So,
and yeah,
hmm. So, doctor, as you said, there will be symptoms. Mostly children become asymptomatic. That
yeah.
means they will be having hepatitis A virus. They'll be infected with hepatitis virus, but parents or children may not be able to know that they are being infected with hepatitis A. But in this condition, can a child transmit the virus to the other family members?
Yes, yes. Why not? Because we call it in our language anictic hepatitis. They have
Okay.
hepatitis, but no visible jaundice. It means they are excreting the virus in their excreta, waste, fecal matter. So they can definitely they can the family member who are in close contact, the siblings and the parents or and if the children living in the hostel. So in the hostel, they are in one room. There are 4 or 5 children, or like that, or crowded place. That's like adult. We army personnel or some hostel like that. So if one is having, and so they can spread to others.
So, doctor, why children are more vulnerable to this hepatitis A?
That's why, because children they are eating outside more. They don't still in the learning stage of the good hygiene and habits, like to wash the hand before taking meals, although the parents they insist, and we are teaching our children always wash your hand before taking anything. Okay, they are gathering in the school, they are gathering in the coaching center, teaching center, the daycare center also. So from there, sometime in the school their bottle, although they take water from the house, but sometimes the water finishes, they take the water from the school or from the school canteen or somewhere. So that is the source of infection in the children. So they are more vulnerable. as compared to adolescent and the adult. Yeah,
So,
because adult can take precautions. Yeah,
yeah. So as you said, doctor, mostly it is we see there is less kind of children don't normally show symptom in the early childhood age. But what happens if hepatitis A affects to an adult or adolescents? How does it affect an adult and adolescent?
as I told you that children less than 2 year, 85%, or two
Yes.
to five 50%. It is reverse.
Hmm.
In adult, 80 to 95% of the adult they are symptomatic.
Yeah.
You have seen the comparison.
Yes.
And out of these, there is 1% mortality in the adult.
Mhm.
99% they recover. 1% they go into acute liver failure. It can be severe or life threatening also. So they are, as we advance these days, whether this is children or as if somebody is immunocompromised on some drugs if they are, or very much elderly or some diabetic or some other thing, so they are more prone to infection and their chances of flaring up of the infection is more as compared to these children here.
Yes.
The children they
So as
recover.
you yeah, we got a clarity that yes, in children age, though the symptoms are not there, but they can
No,
really
they
transmit
have symptom. They have
symptoms.
symptom, but
Yes,
majority they passes through that stage,
stage.
whether the jaundice is not visible unless
Yeah.
you get testing done or you suspect. These days, a lot
Mm.
of cases are coming in monsoon cases, and we are seeing a lot of cases of hepatitis A these days.
Yeah.
So when you say that this is called a sporadic outbreak,
Yeah.
scattered. Some places are coming in some state, and they are coming with symptom like fever, malaise, child not eating, complaining of vomiting like sensation or pain, stomach ache. So then we suspect 3 5 days, then we get the test done. So that is the way. Yeah,
So so what should the family do? We are getting a question from Ms. Nishita Sharma. What should we do if someone is our house tests positive for hepatitis A?
yeah. If somebody in the family is hepatitis A positive, then all family members should take post-exposure prophylaxis. Just like in rabies, we take post-exposure. So all family members should take post-exposure prophylaxis. For that, 1 to
Mhm.
40 year of age, we
Mhm.
can give vaccine, inactivated vaccine, other vaccine. Okay. If the child is less than 1 year, we have to give immunoglobulins. If the adult is more than 40 years, then you have to give hepatitis A specific immunoglobulins. And
Yeah.
that should be preferably you given in the first 10 days when you come into contact. Okay.
Mhm.
Because the incubation period of hepatitis A is 15 to 50 days. I remember like that, 2 weeks to 50 days.
Yes. 2
And
weeks to 50.
sometimes this is happening with us that you give post prophylaxis to a child, somebody's father is having, and the child still develop jaundice. So they come to you, sir, हमने तो वैक्सीन भी लिया है बच्चे को फिर भी jaundice हो गया. Here you have to explain that antibodies development take around 2 to 3 weeks. Number one. Number two, when we give vaccination, your child had already was infected and he was in incubation period. There are two things we have to clarify to the parents. Yes.
Yes. And doctor, if someone has been already infected with hepatitis A and he has been vaccinated, do they need vaccination again in future or they're protected?
If somebody is vaccinated, he will not get hepatitis A.
Hmm. I mean,
Yeah.
if somebody who has already been exposed to hepatitis A,
Yeah, exposed. Yeah,
okay,
because if somebody is, we don't know the, let us say we don't know the status,
yes,
whether he already vaccinated or not vaccinated, but he got the hepatitis A viral infection, then although the immunity is this is lifelong,
hmm.
and as routinely there is no need of giving any vaccination.
So, doctor, how do you screen a public? I mean, a patient who comes to your clinic. He says that I have got jaundice in my childhood, and a public a person who has come that say that I've got jaundice in my childhood. Does it mean that in future he will get or jaundice or not?
Whether the parents they were sure about it, whether this was a documented hepatitis,
Hmm. Hmm.
then which hepatitis it was,
Yes.
whether it was A, it was B, it was C, it was E infection. If he has earlier suffered from A, he can suffer from now. He can suffer with B, C, or he can E.
So jaundice can happen in any of these conditions, like hepatitis A infection, B infection, C infection, E infection.
Right? No, you have to see. As I told you in the beginning, that A and E they are spread by the contaminated water and the food. They are fecal route. But B is through the blood,
Yes.
syringes, and so many other causes of hepatitis B and C. And so one has to see in the community if some cases they are coming and they are consuming, so you can have, and then we go for the lab testing.
Hmm.
If we don't know
Yes.
the status whether you take vaccine, so usually we should do this called hepatic profile. This in profile you have to order liver function test, which we determine serum bilirubin, transaminases, and then in profile you have to A, again hepatitis B surface antigen, then IgM antibodies against hepatitis A, C, or E. You can do it. At least rule out these things, because although these days which cluster of cases they are coming in the community, in one family. Last week I had one child. His sister had hepatitis A. After 10 days, the brother has come to me yesterday. It means something. The source of water is there in the their family, or as you asked in the beginning, that to the contaminated surface or utensil or taking water. So that may be the reason for that.
Right, doctor. So it is clear that yes, I mean, if anybody is infected, there definitely a chance of getting infected, spreading the virus, transmitting to the household people, or getting in touch with contacts later on. Now, doctor, one thing, just how, like, suppose if you see hepatitis A, how serious it could be for people having already liver suffering from liver diseases, or people who are diabetic in those conditions. So how severe is hepatitis A?
If anybody is already having chronic hepatitis, let us say having hepatitis B, the treatment is going on. Okay, so on the top, if you get hepatitis A, it will be worsening, will be there. So it is recommended that any patient of hepatitis B or chronic hepatitis because of any cause, he should get the shot of hepatitis A vaccination.
Okay.
Yes, so they can be worsening.
Okay.
In usually in routine course in children, they get well
Mhm.
in few weeks. Their appetite improve, fever settled, jaundice start regressing, and there is recovery in 99% of the patient they recover. But few, around 1%, they got life threatening, they go into acute liver failure, and sometime in children, although in adult, they go more into liver failure, and even in children these days, hepatitis A is one of the cause of liver failure, and some they even require the liver transplant. So we have to look into this aspect that hepatitis A is one of the important cause of acute liver failure, although not very common. The mortality less than or 1%. Yes.
Like this is one aspect we discussed on, like people having already a liver disease, or people already have suffering from other health conditions. For them, definitely hepatitis A is going to be very much harsh on them. While when we come to another aspect of population, like people who travel, people who, or the school going or the college going children, or the people who stay outside in the hostels or work independently. Uh, I mean, the people who are not having a married life at home and started their career at the early stage of the career. For them, what is your stand?
I think you have answered your question yourself. That traveling,
Yeah.
those who are frequent traveler, they are
Yes.
taking food outside in the restaurant, sometime on the roadside. Vendor are there taking lot of things, and those are in the hostel, they mess, they are taking their food in the mess. And these children, they are more prone, they are at risk of getting this in all the waterborne or food, maybe typhoid fever or viral hepatitis, maybe A or E. And as I told you, where there is mass gathering, like they are in the hostel. Okay,
Yes.
so sometimes they don't able to drink, RO water is there in the hostel, or RO is not working or not effective, whatever may be the reason, and they consume that tap water. So that is maybe the source of infection. So it is must that before going to hostel, they should get a shot of vaccination here.
And what is your stand on, doctor, for the food handlers? Because they could be the source of handle. Like, I mean, because they are handling the food, they are handling the maybe the food processing people who are engaged in food processing or restaurant chain. How high, how they should be more careful in maintaining the hygiene? Maybe
Very
a light
valid
on.
your question you asked. Those who are food handlers,
Yes.
particularly even working in hotel, in
Hmm.
restaurant, in hostel and canteens, they should be screened. And in it is mandatory for all the five stars hotel that they are food handler. They have to, frequently, periodically they have to screen, and they have to go the shot of typhoid fever vaccine. Although
Yes.
they are not recommending hey and the
Hmm.
hepatitis A, so I will also say that you should also get the hepatitis A vaccine also, in addition to typhoid vaccine also. And
True.
they are carrier stage also in typhoid.
True. They can break the chain basically if.
Yes, yes. They are the source of spread of the infection. Carrier,
Yes.
they are the carrier.
Yes. True. Doctor, what are the preventive again? Let us coming to the strategy, like how hepatitis A can be prevented, both in terms
Uh,
of.
yeah,
Uh,
as it said that it is through the fecal-oral route,
hmm,
contaminated water is the culprit. So we got a acronym WASH. WASH mean water, sanitation, and the hygiene.
hmm,
WASH, water, sanitation, and the hygiene. WASH is a multi-sectorial approach collaborated with Government of India, with Health Department, with the community, where the drinkable water which we drink should be not contaminated. So this is the duty of the government to supply us the good quality of the water. Secondly, sanitation, as it is through the feces. So the proper toilet, the cleaning of the toilet, this is very very important. And then the hygiene. Hygiene is good hygiene, hand washing. As you pointed out that in the hotels and the food handler, so they have to be taught about the how to handle this food. Okay, people are eating golgappe, they are putting their hand in water. No, no, this is source. And I have seen that the water which they are using, everyone is surprised. They are going and taking the ordinary water. So, I mean, these are the concepts of public awareness has to be made that this. But government is whether giving all these things to us, able to achieve this target? No. So we have to look to ourselves, and the best is by vaccination.
yeah.
In addition to the VAS, we have to give the vaccination for the hepatitis A vaccine. Yeah.
So now we have come to very clearly state that yes, good hygiene, maintaining good hygiene, that is personally, I mean, it is up to individual person how he maintains the hygiene and what are the preferences of water or the source of food and water. It is purely at the individual stake. Well, when we come as you said in the lastly, the strategy of vaccination, that becomes a Definitely a protection. And doctor would like to understand that how what is the vaccination schedule, and how do you give vaccine? Which age group you give vaccinate for hepatitis A?
Yeah. Hepatitis A vaccine, there are two type of vaccine they are available in the market. Inactivated hepatitis A vaccine and the live vaccine. And this vaccine is given above 1 year of age. Two doses are given. Second dose is given after 6 months. 6 months to you can give up to 1 year also extend 1.5 year also. Second dose you can give. And if somebody has not taken, then we call catch-up immunization is there. Okay, as you said, going to hostel, going
Mhm.
abroad, going to endemic zone, somebody traveling, somebody from non-endemic. India is in mixed endemic.
Yeah.
Earlier it was a high endemic area because some children they are exposed, some they are not exposed. So one should get this vaccine. Did, should I tell the detail about the vaccine or just?
Yeah, just like as we discussed, like children at you said that 1 year and above we give. Up to what age group you give the vaccination? I mean, is it the vaccine equally effective for adults too?
Yeah, this vaccination equally effective for adult also,
Mhm.
and the adult they also need this vaccine. They should get it. But here, whatever vaccine they are available in the market, all vaccine they are not recommended for adult. Some vaccine they are recommended from 1 year to 18 year of age. Some company they are making from 18 year up to 55 year of age. Okay, so adult vaccine one should also get the adult vaccine, and they are equally effective. There no side effect. We have been using for so many years. Maybe some mild fever or some local at the site of injection, some little pain or redness is there, but they are very good and they are also effective. Antibodies start forming within 2 to 3 weeks,
Yeah.
and they say some they ask how long should we
Yeah.
give booster or not? Yeah,
How long we get
yeah.
protected? Yeah.
So there is no need of booster dose as of now,
Hmm.
and the many studies have been done with many vaccine, and some at 10 years, some even 17 years, some even 20 years efficacy there. And when we have some subclinical infection, what it mean? Let us say I have taken vaccine, okay, antibodies are developed, and the antibody titer is correlate of protection mean 20 IU unit antibody should have been developed at vaccination. You start falling, then we are getting some clinical infection. We are getting, let us say, a fewer virus in our cell, and they are producing antibodies. So that anamnestic response is also there.
Okay, great.
So almost there is lifelong immunity there with this vaccine, and as of now, no booster dose is required. Only two doses they are required,
Yes.
and the
So as
dose is
we
0.5 ml. Yes.
So as we summarize, yes, we have a vaccine which is taking care of the children from a 1 year and above, and it is given two doses basically, 1 year and maybe 6 months, after 6 months second dose, and vaccine is very safe and effective, and it gives long-term immunity. So thank you, doctor, for sharing this. Would like to understand any myths. Certain myths are there with hepatitis A. Would like to bust those myths. So like people feel that it's a very mild illness, and it can be definitely taken care if we maintain good hygiene, or we avoid poor hygiene practices.
They are both. Some think that this is a very mild disease. Okay, it is more common in adult, not in children. Adults should get the vaccine. Children should not get the vaccine. Some say that disease is very severe, life threatening. So both way school of thoughts are children are there, and some children, some they think that this hepatitis A disease affect the only a group of person, only elderly, but no. As I discussed that it affected all ages. maybe 1 year, 2 year, 5 year, adolescent, adult, any. So there is some myth that it is affect only the older person there. Some say that, doctor, what is the need of taking vaccine? We can take good water, Bisleri water, and like that, and we can maintain good hygiene. So this is myth. These things, wash technique, they are not 100% foolproof in prevention of the hepatitis A infection. So this is a myth. I always say that, no doubt, but have you tested your water? What is the source of water? Even these, are you going to get the service done of your RO? लास्ट सर्विस आपने कब कराई?
Yeah.
तो 1.5 साल हो गए सर. So like that, so it's good that you are having the good hygiene, another thing, but one should get the shot of hepatitis C vaccine. This is must. Some one patient, asked me, sir, I learned that hepatitis A is transmitted through the sexual activity. He confused with the B.
Yeah.
So sir, so this is, so this again the myth is there.
So now
So
you
we are,
can, sir, since we have brought that point. So
yeah,
somebody is asking about hepatitis B also. So could you
yeah,
please enlighten us? What is the difference between hepatitis B and hepatitis A?
between hepatitis
Hepatitis B and hepatitis A.
B.
Hmm.
Yeah,
Yeah.
the incubation period of hepatitis A is 50, uh, uh, 15 to 50, 15 से 50 दिन का होता है. Rather, and the incubation period of hepatitis B is 50 to 150, long incubation period. Hepatitis A through the water and fecal, and hepatitis B either through the vertical transmission from the mother to the baby. This is called vertical transmission, or horizontal transmission. Horizontal mean the newborn baby can get hepatitis B infection if the infected blood of the mother come in contact with the newborn. Later on, in adult, these who are addicts using syringes, needles, or somebody got the blood transfusion done which was having hepatitis B virus. So, so blood to blood. Somebody had to eat even these, from the barber.
Mhm.
They also
Yes.
one of the cause of hepatitis B. Some the girls and family they are going for a picking of the ears
Ear piercing.
with the gun, ear pressing. So
Tattoo.
they have to be very careful and aware about these things, that these are the guns and all these for ear pricking. They are can be source of infection. Different syringes in the periphery, the quack they are using the same syringes, same oil. So these are the source of infection. Hepatitis A recovers. As I told you, 99% it recover. It doesn't have carrier state. It doesn't go into chronic hepatitis state. On the other hand, hepatitis A is very serious, lead to chronic state. Chronic hepatitis lead into liver cirrhosis, and then even the cancer, and patient, the sequelae of the liver cirrhosis, all these things. So now the government and we all are getting hepatitis B vaccination right in the newborn.
Mm.
That the child is born. Okay. So hepatitis B we are getting infancy, but we are not bothered about the A. We are thinking this is like that. So we have to educate the masses that although we know that hepatitis B is very serious, life-threatening with sequelae and side effect, but we have to prevent the hepatitis A also by hygiene, other thing. And in addition, we have to get the vaccination done. Some they have myths, sir. The vaccination, we can provide lifelong immunity without vaccination. No, this is again the myth. So you have to tell them that lifelong immunity will be with the vaccination. Yeah.
Okay. So we have got a question. Does mother's milk protects the baby from hepatitis A?
Because the survey was done,
Yeah.
it was done zero protective levels.
Hmm.
Okay. Earlier in the pregnant woman, the seroprotection was antibodies were more. These days, because everybody is consuming, aware about this, good sanitation, good quality of water, good quality of food, all these things, and they don't develop antibody level. Okay, so they don't pass antibody to the newborn.
Mhm.
So protection in the newborn is also less, but we cannot give vaccination before 1 year.
Yeah.
As I told you, if any child contract infection before 1 year, then you have to give immunoglobulins to the child. Even in the family member is suffering, as a part of post-exposure prophylaxis, you have to give the immunoglobulins below 1 years.
Okay. Like doctor, we discussed something about adult vaccination. Now, somebody has asked that since there is a test for hepatitis A antigen level, we can go and see whether we have hepatitis antigen in our body or not, antibodies. But uh, how about without screening and going for the vaccination?
Yeah, usually what happen, the adolescents come to you for vaccination. They are going abroad for master classes. They come to a hepatitis A. Now there are two scenarios. Whether you want to do antibody testing, you want to see that the level are about the protection level that more than 20 IU/ml per, they are the protection level for the hepatitis A. Or straightway you want to give hepatitis A. You have to compare the cost. The cost of hepatitis A is less as compared to the testing. Or if you give one extra dose, then no harm. It is up to you after one-to-one discussion with the parents. If you want to give for the testing and if your antibody titer more than 20, you may not require. Or you want to go straight away for the hepatitis A vaccine. Okay. So
Yeah.
both things are there.
Yeah, correct. So we have to see the condition and take vaccinations accordingly, take a call accordingly.
Yeah.
Now, doctor, since we are at the end of this, nearing the end of the program, and any your message to the public for hepatitis A you'd like to give?
I will tell that out of all the jaundice, we call it jaundice. Let us say we call it as a jaundice. Okay. Jaundice occur because of viral causes or non-viral causes. Viral causes, as I enumerated, you say certain vaccine are available. Hepatitis A is preventable cause of viral hepatitis. B is preventable cause. We don't have vaccine against C. We don't have against E. We don't have against D, Delta virus. So at least, and our epidemiological shifting. Earlier, children used to get in viral hepatitis A in early, but now when they are going to hostel, they are getting. So this is called epidemiological shift. And when they are adolescent, the adult is more severe as compared to the younger child. So better to immunize the child when before going to school after the first year. Okay, if somebody has missed, you give catch-up immunization. If somebody going to hostel and not received, you give him the vaccination. So this will be my message that this is the only, in addition to hepatitis B, the preventable cause of viral hepatitis. In addition to taking precaution for wash, that is water, hand hygiene, good quality of food, not eating outside, and not take cut food in particular this season, and all that precaution has to be taken. Yeah.
Now, before we conclude the session, I would take this opportunity to thank all our viewers for being a part of the We Talk to You program. We hope today's session was very informative and valuable in spreading awareness on hepatitis A in children and adults. Our special thanks to Dr. Satish Sharma for sharing his time, expertise, and insights with us today. For those who would
There
like to
was
read,
there is one question here
yeah,
that the dose in children is zero point 0.5 and
yes,
adult is 1 ml.
1 ml,
Okay. Yeah, this is because of the dose of the antigen.
yes,
Yeah, if we give up to 80, antigen dose is less. But if we want to produce more antibody, immunogenicity, so we
immunization,
require more adult also.
yeah.
So that's why the dose is double in adult also.
adult. And these are all based on the studies of
Yeah,
immunogenic response on
right.
the both prenatal. So, for those who would like to revisit the program, the video will be available on our official social media channels. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Do like, share, and spread the word to as many, including friends and family and relatives. Until we meet in our next live talk, stay healthy, stay aware, and please take good care of yourself. Thank you so much. Thank you so much, Dr. Satishan.
Thank you very much. Thank you, everyone.